Assalamualaikum warahmatullahi wabarakatuh. Good afternoon. Thank you for joining me today. My name is Radifa Namazaya, and today I will be presenting this research project that explored the relationship between ultrasound parameter and growth of children at age 2 years. This project was led by Dr. Julian Dewantiningrum, Dr. Farid Agung Rahmadi, and Dr. Dimas Tri Anantyo. Before I begin, I would like to thank to the professors, to the doctors and the participants. This would not possible without you, and I would also like to thank my friends and my family for their support. Infants experience a rapid increase in the first 100 days of life. It's a very important phase to pay attention to the growth of children so that they can detect abnormalities as early as possible. The process of child growth starts from conception to adulthood. Physical growth that usually assessed are weight, height, and head circumference. Ultrasound examination is a diagnostic method that uses ultrasonic waves that can provide information on fetal growth. Fetal growth assessments such as biparietal diameter, head circumference, abdominal circumference, and femur length. The example of the condition of failure to grow and develop is stunting. Based on basic health research or Riskesdes in 2018 showed the prevalence of stunting in Indonesia reached 37.2% in 2013 and decreased to 30.8% in 2018. However, this is still far from the target of the World Health Organization, which is 20%. This research through the Obstetric and Gynecology Department and also Pediatrics Department, classified as Analytic Observational Study with a cross-sectional approach, took place in 14 city health centers in Semarang, start from April until September 2021. For the sampling method, we use consecutive sampling. For the sample are children at age 2 years old. For the independent variables are ultrasound parameter, and for the dependent variables are child growth. For the inclusion criteria, such as children aged 2 years old domiciled in Semarang, have complete ultrasound records, good child nutrition, ultrasound examination performed by obstetrics and gynecology specialists who have certificate of basic ultrasound examination and democratic parenting. Exclusion criteria, such as children with congenital abnormalities and mother has comorbidities during pregnancy. For data analysis, the data that has been collected is analyzed statistically. The data is less than 50, so we use the Shapiro-Wilk test. The data are all normal, so distributed by the Pearson correlation test. For univariate analysis of research subjects, maternal age was divided into 4 categories. For the first category, 14 until 19 years old, there were 2 mothers. Second category, 20 until 29 years old, there were 24 mothers. For the third category, 30 until 39 years old, there were 18 mothers. And for the fourth category, 40 until 49 years old, there was 1 mother. This study included 26 girls and 18 boys. The average for biparietal diameter is 5.51 plus minus 1.35. The average for head circumference is 19.63 plus minus 2.71. The average for abdominal circumference is 17.45 plus minus 2.72, and for the average for femur length is 3.79 plus minus 0.64. And for the child's growth, such as height, the average is 83.48 plus minus 2.61. For the average for weight is 10.81 plus minus 1.35, and for the head circumference, the average is 47.12 plus minus 1.19. For the bivariate analysis between biparietal diameter, head circumference, abdominal circumference, and femur length with height, the only correlation that is significant with height is only head circumference. Meanwhile, the bivariate analysis between biparietal diameter, head circumference, abdominal circumference, and femur length with weight showed that all parameters have significant correlation with weight. For the bivariate analysis between prenatal head circumference and postnatal head circumference showed they have significant correlation. In this study, it was shown that there was a relationship between ultrasound and child growth. According to Kamida et al., children's growth is connected starting from conception until adulthood. The results of the Pearson test in this study showed that the relationship between femur length with height was not significant, while the relationship between femur length with weight was significant. This is incompatible with Cheshire et al. That said femoral length is associated with height, and in the same study, femoral length is associated with weight. In this study, there was a significant relationship between head circumference with height and weight, and also biparietal diameter with weight. But there was no significant relationship between biparietal diameter with height. Biparietal diameter and head circumference are two parameters to assess fetal brain size that can predict child's brain development that related to somatic growth. Fatal-Walewski et al. Said that children's brain development is related to children's weight, and height is significantly associated with head circumference. In the study, there was a significant relationship between abdominal circumference with weight, but there was no significant relationship between abdominal circumference with height. Chacheri et al. Said that abdominal circumference is not an indicator of growth in weight and height. Biparietal diameter, head circumference, abdominal circumference, and femoral length are parameters to assess estimated fetal weight using the Hadlock formula, where estimated fetal weight can be used to predict the weight of children at the age of 3 years old. In the study, there was a significant relationship between head circumference in the prenatal period and head circumference in the postnatal period. Sicard et al. Said that head circumference at birth reflects head circumference in prenatal period, which is associated with cognitive and motor development at 2 years of correction. The growth of children in prenatal and postnatal period has many factors. Factors that can affect growth, such as genetic, can affect fetal growth. Maternal factors that can affect child's weight, such as diabetes, smokers, and hypertension. Meanwhile, the fetal factors such as gender. Nguyen et al. Said that the child who lives in the city has better weight than those who live in the village. Early initiation of breastfeeding and the duration of breastfeeding have significant relationship with weight, but not with height. Kusin et al. Said that the children's growth can also be influenced by supplements consumed by mothers during the 3rd trimester. It can increase the child's growth in the early 5 years of life. Limitation of the study include the number of subjects involved in this study less than previous studies. If the number of subjects is more varied and the sampling method used is different, it is possible to obtain different results from this study. This study also didn't pay attention to the nutritional intake that entered the mother during pregnancy and in the children, and also didn't pay attention to the history of the disease in the children. Based on the results of the study, there is a relationship between ultrasound parameters during pregnancy and the growth of children aged 2 years. Further research can be done on ultrasound parameters in the first 100 days of life using cohort or case control research methods. In the future research, it is expected to pay attention to the history of the child's disease and the nutritional intake. That concludes my presentation. Thank you for joining me today. Wassalamualaikum warahmatullahi wabarakatuh.